laid out its concerns about the new immigration proposals that would limit the number of overseas workers employed in the sector. Well, earlier I spoke to Danny Mortimer, who's co-convener of the Cavendish Coalition and chief executive of the NHS Employers, which is part of the NHS Confederation. He began by telling me what the new government proposals were in relation to overseas workers.
We have to have a new system as a country from January, as we end our transition period from leaving the European Union. And the rules that the government want to put in place will award points to jobs that they defined as highly skilled. And they base that definition on salary. Basically, if you earn above a certain level, £30,000 a year, you will be, and then match certain definitions, you'll be eligible for points. And our concern for the social care workforce is that we have a huge reliance on international workers in social care. They earn a lot less than £30,000, and they therefore just won't fit as part of the system, or won't fit as part of the system in any kind of meaningful or helpful way.
Of course, since those rules were drafted up and our exit from the European Union was confirmed by the British public several years ago now, since then the definition of a skilled worker has changed. Certainly it has in the last 4 months, and arguably now even the Prime Minister would say skilled workers saved his life when he contracted coronavirus. Skilled workers, albeit workers in the healthcare industry at relatively lower levels of particularly pay, and that's a contentious issue that we might come to in this conversation. Do you get a sense that the government is now reassessing those rules, that skilled workers welcome if they earn a lot of money and bring something positive economic benefit to the United Kingdom? Have you got a sense that the government thinking is changing on that?
Based on the immigration bill, sadly, no. We've always known, we've always believed that the people who work in social care are highly skilled. Any of us that have had an elder cared for in a social care setting will recognise the enormous skill that goes into caring for the most vulnerable and dependent members of our families. But this immigration policy, as currently designed, doesn't provide that recognition that you speak of. And I think it is out of step with the kind of recognition and celebration of the contribution we've seen for social care and health staff over this last 100 days. And that's really disappointing.
Yeah, the country has told the authorities what they think. We've been clapping for carers and marking just the other day, marking the 70th, or is it 70th anniversary 72nd, apologies, of the National Health Service. So we know what the great British public think. I'm trying to, and forgive me for pressing on this issue about the Prime Minister, because what I perhaps should have asked you is, do you get any sense that they are minded to reconsider the rules as they stand with regards particularly to health care workers, the ones that we've been clapping for?
Yeah. So, I mean, our reason for writing as we have, 30 odd organisations across social care and health, employers and trade union organisations, is to appeal directly to the Prime Minister and to ask him to intervene on this issue. Because we do believe, as you said, he has a particular insight and appreciation of what this workforce contributes, and in particular what international members of this workforce contribute. There are particular issues facing the social care workforce. I think the government over the last 5 or 6 years has taken a number of steps that have made it easier and more sustainable for the NHS to recruit abroad, particularly for doctors and nurses and other healthcare professionals. We need a similar step in place for our social care workers, the care assistants, the domiciliary workers who work in care homes and in people's own homes, and providing much needed and really important care, particularly to our elders.
Yeah, why can't we provide the workers needed for our own healthcare system in general, but for care homes. I'm intrigued by that, and it'll be a question that you would have been asked several times, probably by general members of the public who don't quite guess it. Even last night on the phone-in, we were talking about Britain's role post-Commonwealth, etc., because of Harry and Meghan's conversations about, we need to look at the sort of inglorious sides of our Commonwealth relationship as well. But somebody called up, and the woman said, why we have switched from being producers in this country to being consumers, and therein lies the problem for the economy, the wider problem for the economy. And it would seem like care homes, even though they're not, part of the commercial economy, well, you could argue, they are also constrained by the fact that we don't produce care home workers anymore. Is that the reason?
I think there's a couple of things to say. I mean, I think the social care sector in particular really needs a long-term plan from us as a country, and the Prime Minister has committed to delivering that plan as part of the government's manifesto, and the plan is anticipated at some point next year. And that plan, I think we all hope, will bring with it certainty and investment in terms of the social care sector. My colleagues in social care really can provide hugely attractive careers and hugely rewarding jobs to people who come and choose to work in social care. And there's an enormous amount of the social care workforce who are UK nationals. But that lack of investment, and that lack of investment has been pronounced now for many, many years, does mean that the rates of pay in social care in this next year or two, are going to be a lot less than we pay in the NHS, for example, or a lot less than people might earn working in retail or hospitality.
That strikes me as strange, and forgive me for cutting in there, Danny, because a lot more, as I understand it, is being asked of care workers at the moment, with all the controversy around the issue of deaths in care homes. How can it be that they're being asked to do a lot more, and anybody who's cared for elderly relatives or sick relatives will know that you can barely cope with being asked to do more. They're being asked to do more, and yet there's no sort of consideration, despite the public mood, as to the importance of their work. There's no consideration to even up the level, the financial entry level into the industry, if that's the right way of describing it, that you would expect. I'm gobsmacked, to be frank. It
is shocking. As a country, we have failed. Successive governments have failed. Red, blue, and combinations thereof have failed to put in place a system that properly funds social care provision in this country. And because that economic model is pretty fragile, to be honest, Dotton, and that means that pay is one of the things that gets squeezed. The NHS and social care are made of people. We have buildings and we have facilities, and it's really important. But fundamentally, we are made of the people who work in our organisations, and in social care, the economics aren't in place to properly invest in pay in the way in which I know social care organisations want to. They do want to better reward their people, not least because of the experience of the last few months. They do want to be much more competitive in the job market in terms of attracting people in to work with them. And hopefully the government will deliver a plan that helps them do those things. But whilst the government is delivering that plan, the reliance that we have on fantastic colleagues from overseas to fill the gaps, 15% or so of the social care workforce are drawn from overseas. We're going to need to continue to look to those colleagues to come in and work with us. And then hopefully once the investment comes in from the government, we'll be less reliant. I don't think we can promise that will disappear very quickly, but we can be a lot less reliant on overseas workers because we can properly reward the people who are working there, and we can attract more people domestically.